We begin tonight with more promising news in the vaccine front during what has been a historic week for one of the largest vaccination campaigns in U.S. history.
A government advisory panel voting unanimously 20-0 to back the Moderna coronavirus vaccine. That sets the stage for the FDA to approve that vaccine by the end of the week. The approval seems likely, which would make Moderna the second vaccine to hit the market in the U.S., where the COVID crisis continues to get worse.
The U.S. continues to set records for daily coronavirus cases and deaths. More than 3,600 Americans died yesterday, more than any other day so far. And it's the fourth time that number has been above 3,000 in less than a week.
So a green light from the FDA could send millions more doses of shots to hospitals throughout the nation. NewsNation correspondent Marky Martin live in Dallas for us tonight with that story. Marky?
Yeah, Joe and Marnie, this independent FDA advisory panel met virtually for 8 hours today, and they met with some of Moderna's top physicians and researchers to discuss this choice. And like you just mentioned, they voted unanimously in favor of this Moderna vaccine having benefits that outweigh the risk. Only one person chose to abstain from voting altogether. Nobody voted no. And now Moderna is one step closer to becoming America's second COVID vaccine. It's been the modern-day medical miracle the world has watched come to fruition. Two novel vaccines designed to fight off a virus we haven't even known for a year, both being touted for effectively preventing the virus. First up, Pfizer winning the FDA's approval, which quickly led to the first shots seen around the world. Today, it was Moderna's turn for consideration.
To see a vaccine brought to market this quickly with this level of effectiveness at 95%, just like the Pfizer vaccine, is nothing short of miraculous, to be honest.
The independent advisory panel reconvening in a virtual meeting that was live streamed to the public.
We're looking forward to your thoughts and comments regarding the scientific evidence that will be presented by Moderna and the FDA.
Emergency use authorization for Moderna has been expected. On Tuesday, FDA reviewers released a 54-page report in which they underscored the two-dose regimen having a favorable safety profile with no specific safety concerns identified that would preclude issuance of an EUA. According to the report, the most common adverse reactions were pain at the injection site, fatigue, headaches, muscle and joint pain, and chills. Both health experts and state leaders across the country gearing up for Moderna's anticipated rollout. In Texas this morning, Governor Greg Abbott telling Texans he believes much of the general public will have access to vaccination before spring.
Yes. There will be widespread distribution because remember this, both Pfizer and Moderna will be increasing the volume of production that they have, but also we do expect that before we get to March, there will be additional vaccine providers.
And also important to note here that the FDA does not have to follow the guidance of this advisory committee, although they are expected to do so. If you take it back to just last week when Pfizer was given the green light, this committee formally recommended that the FDA approve it on Thursday, and by Friday evening we saw that green light come down. So we could have this second COVID vaccine as early as tomorrow. Reporting live in Dallas tonight, Marky Martin, NewsNation.